Today I'm speaking to you from Singapore. And today isn't a lecture or a checklist, it's a conversation about one thing: keeping your voice for as long as possible. Everything sits on the idea of capacity. People imagine a clear moment when capacity is suddenly lost. In real life, it fades. Early on, many people with dementia still understand, still decide, still express what matters to them. Later, things become patchy, and much later, the ability to weigh up information and to communicate a decision may no longer be there. My father didn't talk much about how he felt. He was hard to read, but I could see change in ordinary places. Sudoku, which used to relax him, became frustrating. Movies became hard to follow. The news became noise. Then came the tax return. He kept insisting he could do it, even as confusion was starting to show through. In the end, I took it off his shoulders and gave it to the accountant. Not to take power from him, but to protect him. Families struggle because they don't see a bright line until they've already crossed it. And I've been asked many times, sometimes too late, should we have done this earlier? Almost never the other way around. Planning early isn't pessimism, it's timing. It's doing a few important things while decisions are clearly yours. So the people who love you aren't forced to guess later, under pressure, in grief, or in conflict. One place this becomes very real is medical decisions. I've seen families in hospital rooms where everyone wants to do the right thing, but nobody is certain what the person would have wanted. A spouse swings between hope and guilt. Adult children bring different memories and different fears. When your wishes are never clearly stated, your family doesn't just grieve the illness, they grieve the uncertainty. That's what an advanced care plan or advanced health directive is in human terms. Not paperwork. It's a voice carried forward in time, a way of saying, this is what matters to me. This is how I want decisions to be made if I can't speak for myself. When that voice is missing, families can spend years replaying those moments, wondering if they got it right at the time. The hardest part is not the documents, it's the conversations. Families avoid these talks for understandable reasons. They don't want to upset anyone. They don't want to be seen morbid. They don't want to take away hope. So they wait for a better time. And then decisions get made after a fall, during an admission, in the corridor with everyone emotionally flooded. This is one of the quiet strengths of a long term family doctor. Not dramatic interventions, but gentle coaxing, the slow, respectful push towards extra support, toward conversations that are easier to have now than later. Now let's talk about support, because this is where love can unintentionally become a trap. My mother was determined to manage the situation herself. And I see the same pattern again and again. Spouses cope and cope and cope. They reorganize life, they adapt, they tell themselves they can do it a little longer and a little longer. And often for a time, they can. Then the dementia progresses. The care becomes more and more complex. Sleep is disrupted. Safety becomes harder. The carer is aging too. Exhaustion becomes the daily background. Even in the early stages, when families try to organize help, home help, it can be surprisingly hard emotionally. A cleaner comes in, and suddenly your mother is saying, they didn't clean properly. They missed this, they missed that. I've heard that exact complaint so many times from different families that it almost feels like a universal phase. Sometimes it really is about the cleaning, but often it's about control, privacy, some pride, and the discomfort of a stranger moving through your home. The work can be simple, the emotional meaning isn't. And then there's another sharp point that doesn't get talked about enough: continuity. In Australia, home help can mean a rotating cast of carers. Different people coming into your home each week, sometimes a few times a week, different faces, different styles, different standards. And for many families, that lack of continuity is more destabilizing than physical tasks themselves. A familiar face can feel like care. A constant stream of strangers can feel like intrusion. If personal care is involved, that feeling intensifies because it's not just help, it's intimacy. Many people can tolerate one trusted person, but they struggle with a parade of unfamiliar people doing private tasks. We are not designed for detached, robotic care. We need familiarity. Someone who understands how the person likes things done and how to speak to them with warmth and respect. And personal care is even harder. My father did not want anyone else to bathe him. The resistance is very common. It's not just stubbornness, it's dignity, it's embarrassment, it's the private parts of life becoming public at exactly the time a person feels most vulnerable. Families can manage meals, shopping, reminders, and routines, but once intimate care becomes necessary, love alone can't solve it. That is often the point, where professional help stops being optional and starts being necessary, even if everyone hates the idea at first. I've had patients return and tell me, with guilt and sadness, that they have had to put their spouse into aged care because they simply can't do it anymore. Not because they stopped loving them, not because they gave up, but because the care required has outgrown what a partner can provide at home, no matter how devoted. And I will tell them this is perfectly fine. There comes a point when professional help is necessary. It can be better for the person with dementia, and it is necessary for the carer to look after themselves too. They're both aging. The goal is not heroic suffering. The goal is safe care and a family that survives the illness. But I also want to name something that sits underneath many families' fear, especially in Australia. People have a bad taste in their mouth about aged care. They've seen stories in the media, they've heard about neglect, poor conditions, mistreatment. The Royal Commission brought a lot of this into the open. And even if a family has never experienced it personally, those stories linger. And the sting can linger even when a particular facility is good because fear doesn't update as quickly as facts do. That fear is real. It deserves respect, not dismissal. At the same time, it is also true that aged care is not one single thing. There are good services and poor services. There are safeguards and complaints pathways. There are families who stay closely involved, and in many cases, professional support is what prevents a situation at home from becoming unsafe and unmanageable. Now I want to speak to my North American and UK listeners as well, because the emotional reality is the same, even if the systems are different. In the United States, home care can be excellent, but it is often expensive, fragmented, and hard to sustain for long. Families can face sudden financial strain, and the burden can fall heavily on one spouse or one adult child. Continuity can be a problem there too. Agencies change staff, people leave, rosters shift. And when dementia care becomes 24/7, many families realize that love, even strong love, cannot replace a trained team. In the United Kingdom, families often assume the health system will automatically cover what is needed. But social care works differently. There are assessment, thresholds, wait times, and financial testing. And again, home help can feel impersonal if it's rushed and rotating. The emotional discomfort of strangers coming in and out of the home is not unique to Australia. It's a human reaction. So, whichever country you're in, the core challenge is the same. Planning. Planning is not just legal protection, it's preparing for the moment when care needs change faster than family can adjust. Adult children often see all of this from a little more distance, and I include myself in that. We can see the exhaustion, we can see the frustration, we can sense the risk building. We can also we can see the cracks before the parents admit them. We encourage planning, we persuade with little effect, and we feel helpless watching both parents struggle, knowing that what is likely to come, but unable to force the timing. And then there's the system itself. Even when families are emotionally ready, the aged care system can feel complex at exactly the time you have the least emotional bandwidth. Home help, packages, assessments, finances, fee structures, they can all feel like foreign language. One thing that helped me a lot was outsourcing parts of that navigation to someone who understands the system and can translate it calmly without judgment and without trying to sell you anything. When you're tired and worried, that kind of guidance can take a huge weight off the family. This episode isn't about treatments or drug headlines. Those topics matter, but they can also become loud and confusing. And I don't want to rush through them in a way that leaves you more anxious than before. Today is about the groundwork. It's about the quiet, protective steps that keep your voice present for longer and make life gentler for the people who love you. Planning early is not surrender, it's a deeply practical form of care. It reduces fear, it reduces conflict, and it protects dignity. If you're listening and you feel a tightness in your chest or a sense of grief in the background, I want you to hear this clearly. You are not weak and you're not alone. Many families walk this road. Many people do better than they think they will, especially when they stop carrying it in silence. So take this slowly, one conversation at a time, one decision at a time, and you don't have to solve the whole future today. You just have to keep your voice in the room while you still can. And if you are supporting someone with dementia, please remember this too. Caring doesn't mean doing everything yourself. Caring also means letting support in. That's where I'll leave it today. Steady, calm, and respectful of what you're carrying.